Ali Raja, the Executive Vice Chair of Emergency Medicine at MGH. Dr. Raja, great to have you here.
Thanks, Erica.
All right, Dr. Raja, so what do we know about this antiviral pill, and how could it change the work that you're already doing in treating COVID?
Ben, it's a great question because, quite honestly, we don't know all that much yet. All we've seen so far is a press release by Pfizer, but it all looks promising. Right now, what it is that they tested a new drug that doesn't even have a name yet, and it was given in combination with an old antiviral medication called ritonavir. And they gave it twice a day for 10 days. And what they found is that for patients who were being treated at home, it kept them from having to go into the hospital or, God forbid, dying by 90% compared to placebo. So it sounds great. The main benefit of this medication and the Merck pill that Erica just talked about is that right now the treatments that we have for COVID are all IV. So it'd be wonderful to have oral pills that people can take at home.
And it would, reduce strain on hospitals,
sure.
Obviously. So this is not meant, though, to be a substitute for getting that vaccine, correct?
No way, Erica. The vaccines are still the best way to prevent getting the virus in the first place.
All right, so the other big news, of course, this week is younger kids, 5 to 11, can now roll up their sleeves to get their shots. I'll tell you, my school district offered a clinic for next week today. Within 5 minutes of the spots going out, the appointments were gone. Yeah. I don't think a lot of parents here in New England are hesitant, but there are some, and there are many across the country who might be. So what do you tell parents who are hesitant still about getting their kids vaccinated?
You're absolutely right, Ben. I mean, we've got appointments set up for our kids for next week, too. And most of the folks I know who are parents have done the same thing. But you're right. With people still hesitant, what I would tell them is, look, go and talk to the doctors that you trust. Talk to your kids' pediatricians. You've trusted them with questions about your kids for years. Ask them about this and listen to them. Every pediatrician I know is really supportive of the COVID vaccine. And so I tell patients who I'm just meeting for the first time in the ER, even if you don't believe me, go talk to your pediatrician. You already trust them in this.
Well, and so it was around this time of year. Last year, we realized holidays would not be what we had hoped. What are you expecting this year? Do you think we're past fears of another winter surge at this point? Do you think people can celebrate kind of more traditionally again?
Okay, it's going to be different around the country. There's going to be plenty of places around the country with low vaccination rates, and they're probably going to see a surge just like last year. There's not much different for them. But states like Massachusetts with high vaccination rates are going to be different. We might have a little surge because we're going to be spending more time indoors, but it's not going to be anything like last year, mostly because of the fact that most people over the age of 5 are able to get vaccinated. We should have a much better winter than we did last year.
So get those kids vaccinated and go get it yourself if you haven't done it before the holidays. Dr. Raja, good to see you. Have a good weekend.
Thank you. You too.